PrEP is prevention before you take a risk, before you're exposed. And basically, it's anticipating a risk. It's realizing that you could catch HIV. And I suppose it's analogous when you travel and you want to make sure you don't catch malaria. You take a tablet every day to make sure you're protected. This is when you're out and about and you're going to take a sexual risk. You want to protect yourself against HIV. This is a tool that we have that can give us protection, and prevention is highly effective. We're using a medication that has been in use for 2 decades. It's been shown to be safe, it's been shown to be effective, it's pretty non-toxic, and this is an evolution of its use from initially where it was used for treating HIV infection, then it was used for protecting people after they'd taken a risk. Now we're using it in anticipation of the risk. PrEP is a chemical condom. It protects you against HIV. It stops the HIV reproducing. It's a bit like a preservative that you take, but you have to take it before you take the risk, and you have to continue taking it. People who are at risk, people who are taking risks, people who are over successful socially, people who are having sex, casual sex, partying, chemsex, sometimes people using dating sites. Some of the dating sites we know are used by people who are HIV positive, and people who travel into areas where HIV is very common and where sexual risk-taking is very common. People on sex tourism, that's certainly a possibility. But certainly one needs to speak to a physician, an advisor who can advise people about their risks and give them an objective assessment. We know unprotected, receptive anal sex is the riskiest. The other people who should take PrEP are people who have a HIV positive partner and the viral load isn't suppressed, or they've met somebody or the new diagnosis of HIV and they're waiting for the treatment to kick in to suppress the viral load, and that can take 6 months. Or of course if they're with somebody and the person refuses to be tested and they don't know their HIV status but they're anxious about it. Today testing is so important because early treatment is the secret to the optimal success in managing HIV. HIV is a treatable lifelong infection. PrEP is very specific for HIV, and it will not protect you against catching other infections. And this is one of the reasons why we recommend that people on PrEP should be checked every 3 months. 1, to confirm they haven't caught HIV, and 2, to make sure they don't have other infections. You know, we're all focused on HIV today. We forget that it isn't so long since syphilis was the great killer and was as lethal as HIV. And since HIV has become less feared, we've seen epidemics of syphilis throughout Western Europe, particularly men who have sex with men. Now, we can treat syphilis, we can cure syphilis, it's very straightforward and easy, but if you don't get tested, if you don't get screened regularly, you are taking a risk. And I haven't even mentioned gonorrhea, chlamydia, like lymphogranuloma venereum, and lots of the other nearly 30 infections that you can catch if you're too socially successful. PrEP is used specifically to stop you catching HIV. That is what it does most effectively, most efficiently, but it does not protect you against any other infection. For it to work, it has to be swallowed regularly. Compliance is the key to its effectiveness. But if you're thinking about using PrEP, I think it is very wise to talk to somebody who has got expertise in their field. Somebody who's got the ability to take a full, comprehensive sexual health screen, and that also involves, in men who have sex with men, multi-site testing. It's not just the penis, it's also the back passage and also the throat, who do a comprehensive screen and give you an objective assessment of your risk, which means you've got to tell them exactly what you're up to. We see two or three groups of people. We see people who think they're at risk, and then people who think, we see most commonly. We'll see people who are real risk takers, and they won't realize they're at risk and do nothing about it. And then also we see people who've got anxiety and obsessive compulsive disorders, who are not taking any risks at all, but are absolutely scared silly and have very difficult problems in dealing with questions around HIV and sexually transmitted infections. So you need to talk to a health advisor whose expertise in this field, who's familiar with sexual health and sexually transmitted infections, who can do the full range of tests and also has the experience to give you objective and good advice, practical advice. Well, PrEP is widely available in Ireland. We're very lucky in Ireland in that we have a licensed product that you can get from your pharmacies. But the first step in getting PrEP is to talk to somebody who will prescribe it for you, somebody who's got the expertise in sexual health. And the other thing that you could look at is getting advice and help from some of the helplines for sexual health. It's a non-toxic, well-tolerated medication. We've lots of experience with it, and it works. It works very well, over 90% effective. In essence, it's like a chemical condom. But of course, it's different from a condom because it only protects against one infection, HIV. You still have to protect yourself against the rest. Somebody decides, right, PrEP might be for me, and they want to start on PrEP. The first thing we do is check that they don't already have HIV, because it would be an inappropriate medication to use if you already had HIV. So that's the first thing we do. We use a 4th generation test, which shows up positive quite quickly, and once we see they're HIV negative, then we're in a situation to start talking about PrEP. The other thing we do is to set a baseline to make sure they don't already have any other infection like syphilis, gonorrhea, chlamydia, LGV, warts, herpes. So we give them a complete and thorough screening, particularly also checking for hepatitis A, B and C, and offering vaccinations where that is appropriate. We'll give them some routine advice about safe sex practices, about being careful who they choose as a partner, and also, just because we're protecting against HIV, not to neglect the other infections, to use condoms for protection. Well, once you've started on PrEP, the most essential thing is to take the tablets regularly and consistently. What is recommended is that you get screened every 3 months to ensure, one, that you haven't caught HIV, because we know while PrEP is well over 90% effective in practice, there's always a few people who are non-compliant with the medication, and can take risks. We want to particularly make sure that if somebody is taking PrEP, they're a risk taker. So they are taking risks, and they are at risk to catching other infections that can be equally lethal. So we check them for syphilis, we check them for the hepatitis, we check them for gonorrhea and chlamydia and LGV, and we support them as much as is possible and ensure that they are happy with the medication. And also we check that there's no problems with the renal function, because sometimes the medication can affect the kidneys, but that's extremely rare. Most people tolerate the medication extremely well and are quite happy on it.